tell us about yourself.
My name is Catherine Wells, and I'm a nursing student at the University of Texas at Arlington in the Accelerated Online Program. I began this program in January of 2018, and I'm about to finish in May. I'm interested in women's services and or critical care. I have a passion for both of these areas, and through my clinical experience, I have really found a true passion for these. And I have retail experience, which has allowed me to learn how to be a team player as well as manage my time effectively. I also have experience in childcare services, and I'm involved in organizations at the University of Texas at Arlington, including the Nurse Mentorship Program as well as the Pinning Committee. That kind of shows how I like to be involved outside of just school and or work, and I am excited to potentially be in the women's services and or critical care fields.
Where do you see yourself in your career in 2 to 3 years?
I have always had leadership strengths, and I believe that I would make a good charge nurse. I would like to be in that role in the next 2 to 3 years, as well as just continually develop my nursing skills and become one of those very experienced, competent nurses. Also, in addition to that, I have a passion for helping others become nurses, so I would really like to probably get into a position to be a preceptor for nursing students.
What are your strengths and what about your weaknesses?
My strengths are that I am a strong leader and a team player. I like to help others. I'm a very compassionate person, and I like others to rise to their full potential. I also have organization skills and attention to detail. I tend to be a perfectionist, so that kind of goes along with my weaknesses as well. Because I tend to be a perfectionist, sometimes I take criticism pretty hard, and a lot of my time sometimes is spent too much on the details. And although I understand that there's importance in details, I also understand sometimes you just got to get the job done. So I'm working to kind of balance my strengths and my weaknesses in that aspect.
Talk to us about the value of teamwork. What did you do in your last job to contribute towards teamwork in an environment?
Teamwork is very crucial, especially in the nursing profession and anywhere in the healthcare field, because in order to successfully care for a patient and have their best interests in mind, the whole interdisciplinary team needs to work together and get along while advocating. In my previous retail job, I was a team leader. I got promoted to a team leader after about 6 months of working there. And because I had a lot of younger people, I was a high school job. So I was a college student and I had high schoolers working under me. And the value of teamwork in that scenario was that in order to reach our goals in the business, I really had to utilize the strengths that my team members had. And if it was a person that really enjoyed working with the customers, I would encourage them to welcome the customers when they came in the store. If it was someone that worked well with organization, I would have them put the merchandise out and organize it well. So I think teamwork is about taking everyone's individual skills and using them to get the job done in an efficient way.
Please describe a situation that required you to... Tell us about a situation in which you had to speak up or be assertive in order to advocate for a patient or idea in order to get an important point across.
The first scenario I think about whenever I think of advocating for a patient was whenever I was in my med-surg clinicals. We were on a med-surg floor, and we had a patient that was transferred to us from the critical care unit. The reason this patient was transferred from critical care to med-surg was because she was passing away, and they wanted to make room in critical care for someone that was going to survive. So I went to report with the critical care nurse and the med-surg preceptor I was working with. And we sat through a report, and then we assessed the patient. And after a while, we had other patients obviously, and my nurse was busy. After a while though, I noticed her name wasn't written on the board or anything like that. And although this patient wasn't awake and alert, she also didn't have any family there with her. And the compassionate side of me really wanted to treat this patient with dignity and respect and treat them like an individual, even though that they were transferring from life to death. And so what I did was I asked my nurse, I said, would it be okay if I wrote this patient's name on the board? And she said, of course. She had kind of gotten busy with the other patients, and she told me to just go in the room and do that. And so I did, and it was really rewarding because I felt like, whether or not this patient even could hear what was going on or knew that we were doing that, to have the ability to give someone that dignity at the end of life was really special to me.